and I hand over again to Fasad Ali for the next talk. Thanks again.
Thank you. Thank you very much, Lars. Great talk. So the next talk is by Dr. Santiago Redondo. It's one of the FPA submissions, and it's a validation of the findings of the machine learning analysis of OPTUM in polycythemia vera patients. So with Dr. Redondo is a hematologist within Novartis. He has completed his European PhD in pharmacology. He's a physician, and he was a clinical hematologist at the Hospital of Avila, an emergency doctor in Madrid. Without further ado, due to time, I will just hand it over to Dr. Redondo.
Good afternoon. First of all, I would like to thank the Harmony Consortium for giving the opportunity to present this collaboration. And this is a collaboration by the Novartis Oncology Region Europe, and it is the external validation of a machine learning approach performed in a database. We can see that machine learning techniques involve the massive analysis of huge amount of data, and these approaches can generate new variables and hypotheses that didn't receive attention so far. Previously, we analyzed by machine learning a database from the USA, the OPTUM database, which is a massive clinical database, and we tried to find if in patients of polycythemia vera, we could predict the coming of hydroxyurea resistance or thrombosis, which are two very important clinical problems. These results were presented at last edition of ASH. And just as an introduction and as a fast track of the most important results, we found that the phlebotomy dependency and the increase in red cell distribution width at baseline before giving hydroxyurea to the patient could predict the coming of hydroxyurea resistance within the next 3 months. In addition, for the patients with PV that were treated with hydroxyurea for 6 months, we could predict the coming of thrombosis within the next 12 months. And it was a difference with the patients without or with a previous history of thromboembolic event. And just to be brief, the neutrophil lymphocyte ratio and the decrease of lymphocyte, also the red cell distribution width and the number of platelets could predict the coming of thrombosis. And these items and this assessment are not registered in the majority of studies so far. In addition, we made a retrospective analysis of the patients with hydroxyurea who developed hydroxyurea resistance and switched to ruxolitinib versus the one who continued on hydroxyurea, and we found a trend towards lower thrombosis in the patients who switched to ruxolitinib. Of course, these are hypotheses posted by machine learning and should be validated in another databases. The ideal database could be a massive database with a large amount of data. And if the amount of data is strong enough, we could make conventional statistics just to make a strong statistical potency, just to see if this prediction could, if these items could predict the coming of hydroxyurea resistance or thrombosis. And in addition, we could compare in a receiver operator curve this putative novel risk factor for resistance or thrombosis versus the traditional ones. And in addition, we could combine them all in order to build a statistical prediction in order to, given a single patient, before giving the first dose of hydroxyurea, to predict if the patient is a high probability to develop hydroxyurea resistance in a short amount of time, in the next 3 months. And in addition, if a patient is given hydroxyurea, in a patient of polycythemia vera, of course, is given hydroxyurea for 6 months to develop a prediction that this patient is at high risk to develop thrombosis within the next 12 months. And in this manner, this patient could benefit from a strict clinical surveillance in order to try to avoid these thrombotic events. Of course, we think that the Harmony database that now will incorporate MPN data could be a very interesting database in order to validate this hypothesis. We would like to just to reproduce for patients who have gone hydroxyurea resistant, if we have the baseline phlebotomy dependence on red cell distribution with three months before, and see if this could be predicted by these items. And a similar approach could be done for the patients who have been treated for hydroxyurea for 6 months, and then thrombosis is assessed within the next 12 months. This could be a retrospective or even an ambispective with a continuous data acquisition could be done. The final approach, methodology, and protocol is still under construction, and I think it is a nice opportunity to try to validate putative novel risk factors for hydroxyurea resistance and thrombosis in PV patients, and using the Harmony big data in order to validate these questions that could be of interest from the clinical point of view. Just a first introduction of this project. Thank you very much for your attention.